When it comes to coronavirus, Sweden does it differently. No mandatory lockdowns here. The high-risk strategy centres on not doing very much at all. The goal? To minimise social and economic damage. It's controversial, but Sweden's chief epidemiologist says it works.
I think the Swedish approach is at least as scientific as any country's approach.
But Swedes are still dying. The virus has already killed 5,000 from a population of just 10 million. For a few days in June, Sweden had one of the world's highest per capita death rates.
I don't know what to think or what to feel. The only thing I feel right now is, of course, sorrow and sadness.
Hi, I'm Lisa Miller in Melbourne, where the city is once again on alert after a spike in coronavirus infections. It's in stark contrast to Sweden, where in the capital Stockholm, bars never closed and gyms remain open. It's part of a controversial strategy called Lockdown Lite. High schools and universities closed and gatherings of more than 50 people were banned, but the rest of it, social distancing, was largely left to individual Swedes, a voluntary code. But is the pursuit of the Swedish model sacrificing the lives of the most vulnerable in society?
J-O-H-N.
In Sweden, they sing the praises of an unlikely hero.
Anders. Som jag var Anders Tegnell. Jag skiter i andra, jag tror på mig själv. Många järn i samma eld. Kämpar, jag har inte fått massa hjälp. Som jag var Anders Tegnell. På micken med fakta, jag tar inte helg. Ingen kan nudda mig än. Som om det funnits en 2 meters gräns.
Anders Tegnell, mild-mannered chief epidemiologist, creator and driver of the national COVID strategy. His regular briefings have brought him national fame and huge popularity. Stockholm tattoo artist Sashay Tastas is a big Tegnell fan.
He's kind of like the typical Swede. That's probably why we like him, because we can see our father and mother in his beautiful eyes.
Client Gustav Agerblad provides the canvas.
I want it because I think he has done a really good job in this crisis that we are experiencing. When I watch the news and he's standing there, I feel that we are in good hands.
Both agree Anders Tegnell radiates a kind of dad-like Swedish cool.
He has a big dick calmness over him. He's very competent and not braggy about it.
I mean, before this crisis, he was like nobody for the Swedish people. Now he's a rock star.
Opinion polls confirm it's a sentiment shared by many Swedes. Most don't want a tattoo, but appreciate the Tegnell approach.
I want to have the free will on my own, and I really put a high price on that. To have the choice of going to the store when I want, to have the choice to work.
But there's not much empathy here for the collateral damage of the Swedish model, the growing numbers of corona casualties.
Bad luck, I guess. Sorry that sounds harsh, but I mean, I would rather have it like we have had it in Sweden than having it like in Poland or in China or in Bombardier in Italy, where they have closed down the societies almost.
Oh, super cool.
Anders.
Another day, another press conference. Anders Tegnell heads off to the Crisis Briefing Centre. Strong local support for his radical pandemic plan doesn't translate internationally. As the death toll mounts, the stakes are getting higher. Anders Tegnell has recently received death threats, so now bodyguards go with him. He takes all of this in his stride.
Is there a fair amount of pressure in your daily life these days?
Oh, not that bad.
You're one of Sweden's most famous men.
It will pass.
But isn't there a certain something you like about celebrity?
Not at all. I prefer to do my work.
And his job is to stay relentlessly on message. Combat COVID, but keep the country running.
We managed to keep society fairly open and our schools open, not the least, while at the same time delivering good health service to everybody who needs that.
This is not his first high-pressure assignment. Tegnell cut his epidemiological teeth during a deadly Ebola outbreak in the Democratic Republic of Congo in the mid-90s. Now he has to explain to an increasingly sceptical world why, despite the growing death toll, he thinks his strategy still works.
Do you think in retrospect now that trying to stop the disease immediately would have been a wiser solution or do you still believe that this long-term strategy is the way to go?
I mean, we basically still think that this is the right strategy for Sweden that we are doing. This is a bit like having an ocean liner and try to steer it with a lag of 3 or 4 weeks. So I think we are too early to both say that Sweden was right or anybody else was right.
It's a tough message to sell. Sweden may have a much larger population than its neighbours, but its casualty rate has been extraordinary. Unlike Sweden, the other Nordic countries enforced mandatory lockdowns. Today, the Swedes have twice as many confirmed cases as Denmark, Norway and Finland combined. And the fatality rate is even worse, 5 times as many deaths. Despite this infection rate, only 7% of Sweden's population has developed COVID antibodies, well short of the so-called herd immunity rate of at least 70%. That's where so many people are infected, the virus is, theoretically, controlled. Some Swedish public health experts say herd immunity was always at the heart of the national strategy. But Anders Tegnell denies this was ever his goal.
And a follow-up question, do you feel that Sweden has become something of a sort of global punch bag and, taken on by people that, believe in herd immunity or believe in not having a lockdown and therefore, that your strategy has become rather misunderstood?
Yeah, maybe. Sometimes I feel like a personal punch bag, but that's okay, I can live with that.
Spring in Stockholm. The freedoms of the pre-COVID world never really went away here. The Tegnell plan relies on a national culture of individual responsibility, calling on Swedes to voluntarily work from home and maintain social distancing. For couple Mina and Matthias, ensuring they and their 3 children stay safe means following the rules.
Jag tycker den fungerade väldigt bra, vår policy, i början när covid kom. Folk planerade sina handlingar bättre skulle jag tro. Det var inte lika mycket människor i affären.
But compliance now seems to be melting away with the approach of summer.
Så jag tycker att det är bra att vi har en mer öppen, avslappnad inställning. Jag tror inte på att stänga ner samhällen, utan jag är trygg i vår svenska modell ändå.
Mina, who works as assistant director of an aged care facility, has just recovered from COVID. To protect patients and staff, Mina self-isolated at home when she had symptoms.
Nu fick jag för 2 veckor sedan reda på att jag faktiskt har haft covid. Och jag kom väldigt lindrigt undan. Jag hade bara hosta i 3 dagar. och vara trött. Och det känns ju väldigt skönt nu. Jag är väldigt lättad över att jag har haft det.
Nej, jag vet inte om jag har haft det. Sen kan jag väl hoppas det, eller tror det kanske, eftersom man lever ju nära i en familj. Och jag har varit förkyld och lite ont i halsen, men det är inget allvarligt. Men om det har varit någon väldigt lindrig variant av corona eller inte, kan man hoppas på. Men jag vet ju inte.
For Matthias, confirming a COVID diagnosis would have been difficult. Until recently, Sweden did very little community COVID testing. With a nationwide shortage of kits, testing was mainly reserved for the very sick or those in high-risk occupations such as Mina.
Men det som de också säger, det är att man vet ju inte hur länge man har antikropparna, så att det ger ju en trygghet just nu. Men om några månader kanske jag inte har några antikroppar längre. Det är ju ingen som vet, så att jag är fortfarande väldigt försiktig och när vi handlar och tänker på vart jag går och hur nära människor jag kommer i affärer och så.
Much of Sweden has stayed open for business during the pandemic. The GDP is predicted to fall by 7%. That's not as bad as the UK or Italy, but really no better than its Nordic neighbours who did lock down. Yet Mina believes the economy would have taken a bigger hit without the Swedish model.
Jag tror att Sverige kommer nog komma på fötter snabbare än många andra länder, i och med att jag tror inte att vår ekonomi kommer bli riktigt lika påverkad som många andra länders ekonomi. Och det är klart att det finns enskilda personer som har drabbats hårdare i Sverige som faktiskt har blivit av med sina arbeten. Men jag tror vi kommer ändå klara oss bättre.
Many of Sweden's pandemic hotspots are located in the genteel surrounds of Stockholm's aged care facilities. The government did impose lockdowns on old people's homes, but now concedes the order came too late and casualties have been high. Of more than 5,000 deaths nationally, 88% are over 70 years of age, many of them in retirement villages. Team leader Romana Wild admits it's been tough for residents and staff.
Ja, jättesvårt. Vi har haft en jättetuff period för att det är ju mer personal som har blivit sjuka än boende. Vi har ändå lyckats skydda de boende väldigt bra, men det har varit jättetufft. Man har ju märkt att många damer har ju gråtit, varit ledsna. Så att man får försöka avleda med just underhållning som finns att tillgå.
There are 350 residents here. Some have got sick and died, but no one really knows if it's due to COVID because of a nationwide lack of comprehensive testing.
Jag vet inte antal, men här har vi haft några fall. Och vi har ju inte testat alla. Några har ju gått bort hastigt och plötsligt. Man kan misstänka att de har haft covid.
After 2 months of lockdown, restrictions are being cautiously eased.
Anhöriga får ju då boka en tid hos oss. Vi har en bokningslista. Och sen ställer vi upp en plexiglasskärm. Och så har de 20 minuter.
This is the first time Annika Elfstrom has seen her mother Luli since March.
Och sen har det också varit så att min mamma under den här tiden när det varit besöksförbud har ju fyllt 80 år också. Så att vi kunde ju inte fira henne på det sätt som vi hade tänkt och planerat. Så det var jättetråkigt. Jag är fortfarande så att jag hoppas och tror att vi har valt rätt strategi. Och jag tror inte att vi kan veta det ännu. Jag tror att det tar lång tid. Jag tycker nog egentligen att vi har gjort rätt.
Anders Tegnell now concedes that too many have died in aged care facilities, but insists the broader strategy is still on track.
The findings is the high death toll among the people in the long-term care facilities. And that, of course, is a big failure that we really wish we could have done something about. We are doing a lot of things now, and we see that the number of cases in those facilities are slowly falling. So we believe that even that can be rectified, and our strategy will be even more sustainable.
Sweden's ethnic minorities have also been hit hard.
Nya gravar. Majoriteten har avlidit i covid-19.
Miri Guri's father, Joseph, died of coronavirus the day before his 64th birthday.
Jag brukar oftast promenera på morgonen tidigt. För då är det mindre folk här. Nu kommer jag hit, besöker min pappa såklart. Och funderar hur kunde det bli så här.
Fit and active, Joseph was goalkeeper on the national soccer team of his native Syria before he immigrated to Sweden in 1990 with his wife and 3 children. When the pandemic struck, he was carefully following the recommendations issued by Anders Tegnell and his team.
Pappa rörde sig bara mellan sitt hem, sitt jobb på Hemköp och kyrkan. Den 15 mars var han på kyrkoceremoni. Och vi fick till och med höra att många blev sjuka efter den ceremonin. Så att det är en stor chans att det var i kyrkan.
Just days later, the government recommended that the maximum number for a gathering be reduced from 500 to 50. But it was too late for Joseph.
Det var fel, för då skulle inte min pappa behöva avlidas. Då hade min pappa levt idag. För han lyssnar ju på regler och...
Miri's family lives in Stockholm's northern suburbs. This predominantly migrant area is one of the worst hit in Sweden, with infection rates up to 3 times higher than the rest of the Stockholm region. From home to hospital to grave, a disproportionate number of victims are foreign-born, mainly Somali, Iraqi and Syrian.
Det här är beviset på vad som verkligen händer i vårt samhälle i Sverige.
Over the past decade, there's been a dramatic shift in Sweden's demographic. A quarter of the population now has a migrant background.
And here, coming up on the right, it's quite new Syriac Orthodox Church.
Writer and activist Nuri Kino has focused on the pandemic's effects on his own community of Christian Assyrians. He blames the health authorities for misunderstanding the different social structures of migrant communities and for failing to effectively warn of the dangers.
The information that came to immigrant districts or areas was delayed, confusing, and even in wrong languages. People live close to each other, and some of them have also their parents and their grandparents in their homes. We socialize differently. The culture is different to the Swedish ethnic culture when it comes to social life. It's also another of the reasons why we were more affected by the coronavirus, unfortunately.
In stark contrast to confident, bustling downtown Stockholm, the streets in Nuri's old neighbourhood are now eerily quiet.
So this is Gnesta, where I grew up. And if I come here, I always meet relatives and friends, children of friends. Usually there's a lot more people out their balconies. People have become aware of the situation and are more cautious because everyone here more or less knows someone that has passed away.
Nuri's aunt recently died from the virus.
That's my aunt's apartment there, the middle one. And now she's gone. We spent so much time there. I have so many memories from that balcony. Yusuf! Alhamdulillah, salam alaikum.
He watches out for older, vulnerable family members.
So this is my cousin, my oldest cousin, so he's more like an uncle, and that's his wife, also actually my second cousin, and they're like my uncle and my aunt. We're very scared. We're, in the risk groups, both of us, and we're scared that if we would get infected, we would probably not survive. We wouldn't make it.
Anders Tegnell admits immigrant communities should have been better protected, but says government policies are not entirely to blame for the high death toll.
I think one thing is that the disease came into those communities very early on, when very few people had an awareness of what was happening. I think that's part of the reason. The other part of the reason is, of course, they are living with generations together, living fairly cramped. There is definitely a socioeconomic aspect to this disease, which can be shown in many countries.
As the death toll rises, anger's growing in Sweden's scientific community. 22 leading doctors, virologists and researchers called for the Swedish model to be replaced by the go hard, go early pandemic responses of other Nordic countries. One of the dissidents is infectious diseases expert Dr. Stefan Hansen.
I woke up in the night because I was thinking, this is terrible. People are dying and we are letting the infection spread. From the very start, they didn't believe it was going to become an epidemic in Sweden at all. So they didn't take any measures to be prepared for an epidemic. The attitude is taking things too lightly and not to causing panic. And then they also had in the back of their mind, okay, we are going to create herd immunity, so we don't mind too much if young people are infected. The problem is that I don't see any science. There is no scientific background to this strategy.
In a migrant neighbourhood, Stefan Hansen's team sets up shop. His clinic offers an immediate test for COVID-19 antibodies, confirming they've already caught the virus.
Today we are checking antibodies in a suburb of Stockholm, where we know there have been quite a lot of cases of corona infection. So the people here they're almost all immigrants. This is particularly Somali area.
For months, the government did very little community testing. So Stefan Hansen collaborates with a local university that donated these kits.
Swedish testing is very much behind schedule. We are actually doing this to get our own opinion and to move things, to get an idea of what is going on here.
In the eagerness to get tested, social distancing is forgotten. Positive results are common.
Okay. Svagt positiv, du ser här.
Det här båda.
Jaha, jag vet.
Jaha, okej.
Det är därför
Han visste det så.
en månad jobbar i mitt rummet.
Men ni måste...
Det är allt, eller?
Tack. So the last gentleman, the Somali man, he had symptoms 3 months ago, and he has got weak positivity. With testing, automatically comes contact tracing, because according to the law, it is obligatory to follow up. This has not taken place to a large extent, because after Stockholm saw that there was too much spread in society and they couldn't cope, they gave it up. We are just trying to do this to be able to show that what the government and the regions are doing is not sufficient. They have to do more.
There are just 24 test kits. Eventually, the team has to turn people away.
3 positives today out of 24. So some 8-9%. We could test everybody here for sure. We could test the whole day. Government is doing nothing. They're just standing there doing nothing.
All appears comfortable and relaxed in the Stockholm spring sunshine. With the pandemic subsiding in the rest of Scandinavia, travel restrictions are now being lifted. But the borders with Sweden remain closed due to the high ongoing infection rate here. None of this cramps the style of the class of 2020. It's party time, complete with traditional graduation caps. They're full of youthful confidence in the future. COVID restrictions have scaled back celebrations, but life goes on, thanks to Anders Tegnell. Behind closed doors, the other Sweden is gripped by fear and grief. Community activist Nuri Kino has moved in with his elderly mother to support her in isolation.
This is the church that I belong to, that I'm a member, or my family. We are members at this church. All in all, we lost 22 people that 2 deacons, relatives of mine, friends, parents. Just devastating.
The live stream of the Sunday service provides some comfort, but also emphasises the absence of family and friends. This is one community losing faith with their adopted homeland.
The only thing I know is that it didn't work for the elderly and it didn't work for immigrant groups. It didn't work for foreign-born and their children and grandchildren. It's just so sad. I hope that we will learn from this.